Prednisone rashes. Does prednisone cause a rash? Can you take prednisone for a rash? Hi, I'm Dr. Megan, your prednisone pharmacist. I'm here to answer all your questions you might have about rashes. First of all, prednisone can be prescribed for a rash, and yes, it can also cause a rash. That's how prednisone is. It's often prescribed for something, and it can cause that as a side effect. Let's first cover prednisone being prescribed for a rash, and then at the end, I will talk about the allergic possibility as far as what would happen if prednisone is causing a rash. Okay, first of all, what are typical rashes that prednisone could be prescribed for? One of them includes eczema or atopic dermatitis. That's where you kind of have a genetic family history of people in your family having rashes. In my family, we have it on our hands generally, and some family members of mine have it all over, and it can get pretty terrible, especially in stressful times of life. So, should people with eczema or atopic dermatitis get prednisone? Well, for their rash, generally, no. According to the American Academy of Dermatologists, that prednisone is generally not recommended when it comes to a rash. Unless it is incredibly, really bad, life-threatening, it's generally not recommended. There's so many other treatment options at this point. They said, although it is used frequently and shown to temporarily suppress disease, it should generally be avoided because of short and long-term adverse effects and an unfavorable risk to benefit profile. Short courses, like if you only took it a little while, of oral steroids can actually lead to flares of eczema. So we don't want to put ourselves into a flare. We don't want to have worse side effects than the disease itself, which is what can happen with prednisone. And I'll cover what those side effects are towards the end. And then they said topical steroids are recommended. This is the kind I use, mometasone, for hand rashes or other eczema rashes. But taking the pill of prednisone itself should be avoided if possible. And it should be, this is when you could possibly use it, exclusively reserved for acute, that means short-term, severe exacerbations, and as a short-term bridge therapy to other systemic steroid sparing therapy. So basically, only if it's really bad or if you need to give whatever your other treatment is some time to kick in. So other possible treatments could be an injectable or another oral pill that you would take. They don't necessarily kick in immediately like prednisone usually does. And so that's when they say you might use it. Other types of rashes you might be prescribed prednisone for include psoriasis. Psoriasis is where there's plaques often on your elbows, your knees, could be in lots of other places. And prednisone could be used. Often, again, we go for the topical version first, and there are so many other treatment options for psoriasis these days that usually the pill is not recommended. What about an allergic rash? Like you touch something and now you're allergic to it. Should you use prednisone? And sometimes if it's really, really bad, really severe, then it might make sense. But in situations like poison ivy, when you're using that toxic oil from the poison ivy or poison oak or poison sumac plant got on your skin called urushiol, it is generally not recommended to give prednisone for it unless it's severe, meaning it's on your face, like your eyes are not able to open, or it's in your genital area, or it's covering more than a fourth of your body. And your doctor is like, there's nothing else we can do. And then if you were to do it for poison ivy, I cover a whole video about this, but it needs to be for quite a long time. So that's poison ivy. Next, urticaria or hives. If you've got like bumps that are kind of covering your skin and you're like, should I take prednisone for that? Yes or no? Well, they did a study of people who went to the emergency room for hives, and they said that prednisone, which is a steroid, it offered no additional relief to emergency patients suffering from hives than a placebo did, according to a randomized placebo-controlled double-blind parallel group study. So it is not necessarily going to help you for your hives. Instead, they recommend a first-generation antihistamine. In this case, they were using levocetirizine, which brand name is Zizal, or another option is Zyrtec, which is cetirizine, or other first-generation antihistamines. I'll have a whole list right here. But those are a lot better option for hives. And then if you're going to sleep at night, another option would be Benadryl, which is diphenhydramine. That's a first generation antihistamine, and it makes you drowsy. And so you don't want to really have to take that at night. On these, if you were to have urticaria for long term, I have a whole video all about chronic urticaria with an expert, but you'd want to be taking like really high doses of these medications and for a long time. You wouldn't really want to go to prednisone unless you absolutely have to. Last resort, and I'll be covering why in a little bit. As far as doses you might use for a rash, a dose of prednisone you might use for a rash, the range is often between a half of a milligram to a full milligram per kilogram per day. And what in the world does that mean? So if a person is 130 pounds, then that is the same thing as approximately 60 kilograms. Therefore, that person would take somewhere between 30 and 60 milligrams per day. So that's an average American, 130 pounds, somewhere between 30 to 60 milligrams per day is the average dose for an adult who is taking prednisone for a rash. What about timing? When would you notice that your prednisone is working for your rash? It could be instant relief. Like for some people, they are like, after just a few hours after the prednisone kicks in, they're like, wow, it's gone. But for other rashes like poison ivy, it might be 3 to 5 days before you see the effect. And so definitely talk to your doctor, your dermatologist, your pharmacist about your situation, about when you should expect it. But it could be anywhere from a few hours to a few days that you could have that relief provided by the prednisone for your rash. So then, what side effects can you expect if you take prednisone for a rash? There are up to 150 side effects possible, which is shocking, especially for pharmacists like myself. When I was prescribed it, I knew it was bad, but I didn't know it was that bad. And in one study, these were the side effects that people actually reported to the study scientists. This is what they said: hypertension, which is high blood pressure; glucose intolerance, which means high blood sugar; gastritis, which means stomach upset; weight gain, happens all the time; decreased bone density; adrenal suppression; and emotional lability. So emotional lability means up and down, like way higher than you normally get, way lower than you normally get, going from happy to sad really fast, being super cranky, your family wanting to go on a vacation without you. Those are what you can have. If it's a child, they can actually have what they call a decreased linear growth. That means it's harder for them to grow up. People who have to take prednisone long term as a child end up shorter. So we want to avoid it if at all possible. Like at the beginning, the American Academy of Dermatology says the benefit, it just doesn't work that well most of the time for most people because there's so many side effects. Like it just doesn't make sense for most rashes unless they're incredibly bad and you've tried every other option. So what are these other options that you could try instead? So often it's a topical steroid. You can put it on your hands instead of in your mouth, right? It could be other pills. So here are some alternatives. They're usually immunosuppressants, things like cyclosporin, methotrexate, mycophenolate mofetil, azathioprine. And those all, if you Google them, look and sound scarier than prednisone. But in general, they are safer and more effective than prednisone. It's just they have a few side effects that just like look really bad, but are incredibly rare. Whereas prednisone is just generally awful for most people and it has a few incredibly rare side effects that are terrible, but is generally just a miserable experience to take prednisone. So you could take those. There are many new biologics coming out, some that are great for atopic dermatitis, some that are great for psoriasis. There's just a lot of options. If you're wondering what's best for you, definitely make an appointment with your dermatologist. Next, how can you prevent the side effects from happening? The American Academy of Dermatology says these are their recommendations for preventing side effects. They said if you're on a long-term protocol of prednisone, you might need calcium and vitamin D suppression. I invented a supplement specifically for people on long-term or even short-term steroids to give back that calcium and vitamin D. You might need to get immunizations because you're immunosuppressed. You might become really frustrated because your disease might flare. And then you should usually taper off. You don't want to just If you're on it longer than 5 days, generally you need to taper off. Definitely if you're longer than 10 to 14 days, you need to taper off. And then what should you be checking while you're on it? If you're on long-term steroids, they say you should check your blood pressure, have eye exams, check your HPA axis. If you don't know what these things are, bone density evaluation, and growth velocity measurement in children. If you're like, whoa, that's a lot, I've gotcha. I've got a free downloadable PDF checklist. You just click the link below. You can get your own prednisone checklist. It's got all the things to check up to make sure that if you're taking this, you're catching any side effects before they get terrible and you're giving back what you need to give back. It's got all of the best tips I could come up with about prednisone and the side effects and counteracting them. So to download that, and I promised at the end I would also cover what if prednisone itself is causing a rash, right? So we talked first about prednisone treating the rash, being prescribed for the rash. Now prednisone is prescribed for something else, and it could be causing a rash. So in that case, does this happen, and how often, and what do we do about it? So in one study, they were giving people very high doses of prednisone. And actually, they were giving a sister drug to prednisone, which is called methylprednisolone or Medrol. They were giving 48 milligrams of that, which is equivalent to prednisone 60 milligrams. They were giving it for at least 5 days and usually much longer than that. And they measured how many people complained of which side effects. And in this study, 14.7% of people complained of rash as a side effect to methylprednisolone or steroid treatment. And what were these rashes like? What kind of a rash was it? So some people said it was like a hot flash. So I personally had that when I took Medrol. I had bright red cheeks, flushing. I felt like I was a menopausal woman getting hot flashes. And then it could also be just like a few little bumps or pimple-like things happening. Some people get acne, and some people even get these little red dots. They're called petechiae. Other people get actinic purpura. There's a huge range of types of rashes you could get from prednisone. Finally, you could actually be allergic to prednisone, although this is incredibly rare because prednisone itself is usually what they treat allergies with. So it's really hard to get an allergic reaction to a thing you treat allergies with. But if you are in an incredibly allergic situation in your life, for some reason, you've got higher levels of Ig, interglobulins, and your immune system is completely out of whack, it is possible to be allergic to prednisone. And so if that's the case, you would definitely want to tell your doctor, let them know, and they can help you figure out the treatment plan. But when would a prednisone rash happen in general? Well, generally, most people do not get a rash immediately upon treatment. You don't usually get a rash the first moment you take prednisone. Maybe you get hot flashes after the first or couple doses. But according to this one study, it said most cases of skin rash had begun at week 3. They'd only taken 2 weeks of the drug, and then the rash didn't happen until week 3. And they said this was assumed because it took about 1 to 2 weeks until the skin reaction appeared as the immune mechanism acted. And given the drug administration period was only 12 days, it indicated that these adverse effects, these rashes from prednisone, can happen even 1 to 2 weeks after taking prednisone or methylprednisolone. So doctors should keep checking you, making sure you're okay, even 3 to 4 weeks after stopping. And if you are having such a terrible allergic reaction that it's not just a rash at this point, you're having trouble breathing, swelling of your face, your lips, your eyelids, any of your soft tissues, and it's spreading, definitely go to the emergency room. If you're really having a hard time breathing, call 911. It can, allergic reactions are not something we mess with. So get the help you need. And if you are taking prednisone and you're wondering what you can do about short-term treatments and counteracting those side effects, be sure to download my prednisone checklist. Signing off is Dr. Megan, your prednisone pharmacist.